south of Wellington, and so as a 10-year-old in 1973, I'd spend my time after school and on weekend delivering Dad's junk car and prescriptions around the streets of Wellington and Maruwa. And it never occurred to us that it might not be a good idea to send a 10-year-old with saddlebags full of drugs around the streets of the poorest streets of Wellington. I never ever once felt unsafe. Welcomed into houses and lovely people give me cups of tea and orange juice, and it always took a lot longer to deliver the scripts than I thought it would. You just wouldn't do that now. You wouldn't send a 10-year-old even delivering junk mail around those streets. So why are those streets different now? Well, a number of reasons. There are more poor now than there were then, about 2.5 times more, by whatever measure you choose. And the poor are poorer now than they were back then. The poor in New Zealand have also been poor for a long time. Social mobility is the term we use to talk about the ability of the poor to get out of poverty. The likelihood that a child born poor will do well. And we know that if you're born poor in New Zealand, you are very likely to do poorly, much more likely to do poorly than children who are born to wealthy households. The cost of housing is much dearer, particularly at the bottom end. Did you know that the cost of housing that affects all of us has been sharpest at the bottom end of the housing market? And so the families I see crowd together, both for warmth, because they can't afford to heat the house, and because it's just too expensive to have one house for each family. The quality of those houses, as we've all heard, is also deteriorated over that time. And so these houses are cold and damp. And these are good people, good families, who love their children, who work hard, but can't make ends meet. I'm going to be on call this weekend, starting on Friday, in acute paediatrics in Hastings. And I know what I'm going to see. 2/3 of the children in our ward are under 5. 2/3 are Māori and Pacific. They present late, too late sometimes, and very ill. We see diseases that as a house surgeon I just didn't see, like rheumatic fever and tuberculosis and empyema, which is where the whole lung is full of pus. And these are things that our English registrars have read about in textbooks, but never ever thought that they would see. In 1988, when I was a house surgeon in Napier, there were just 8 senior and junior doctors looking after paediatrics in Brisbane. Now there are 16 of us working really hard. And outpatients of the 10 consultants, 3 do nothing but see children from poor families with major problems with their development and their behaviour, because they grow up in poor families and it is stressful. And there is violence, and there are addictions and mental illness. And those things have always been there, but there's just more of it now. I know bless our new entrant teachers very well. And they tell me that about a third of their new entrants arrive at school aged 5 with language of 3.5 or worse. If you arrive at school with language of 3.5 or less, the likelihood that you will leave school with qualifications is almost zero. And we know what the outcomes are for those children. They are very likely to be poorly employed in casual or seasonal work, or simply not be employable because they don't have the learning or the personal and social skills to hold down a job that you need in 2014. We also know that they are much more likely to leave school with an addiction, too early, pregnant, with major mental illness, or criminal behaviour. And the cost of all of that is somewhere between $6 and $8 billion a year. So it affects all of us. Child poverty does not just affect the children of the poor, it affects every single one of us in New Zealand. And it doesn't have to be that way. It's been different before. When I was delivering Dad's scripts, the rate of poverty by the same measures was less than half what it is now. Other countries with similar GDP have lower rates of child poverty than we do. So there are things that we can all do. The first thing I ask is be informed. Childpoverty.org.nz, occ.org.nz. Read the websites, discuss what you learn with your friends and family and colleagues. Be informed. If you're an employer, please consider making your next hire a sole parent. We know that if we look after those parents, if we have policies in the workplace that make it possible for them to look after their children if they're sick, if we can find ways to partner so that with after-school care and holiday programs, then productivity improves, turnover falls, and profits are lifted. If you have the time, or if you have some spare and want to invest that time or income where it will make a difference, think about supporting Salvation Army or Barnardo's or one of the Christian or other social services. They always need a spare pair of hands and the kinds of skills that many of you learn. I think the politicians here tonight are brave for coming, and I have enormous respect for them. Coming down to Wellington from Hawke's Bay every Monday morning for the last 3 years has made me realise just how much they give up to represent us. And that's the thing. Our politicians represent us. They represent our views and concerns, what we care about and what we make a noise about, determine what policy is made, whomever wins on September 20. So what I'm asking here tonight is for all of you, the New Zealand public, to think about how we can invest in our children, particularly our poorest and our most vulnerable. We need a for things that affect all of us, but have a big effect, like biodiversity or the road toll, we have a plan and legislation, and we set targets, and we hold our public service and our leaders accountable for those. I think we need that for child poverty. I think it's at least as important as those things. We just have to find ways to improve incomes at the bottom end, both for wages and for benefits. We must improve the supply and the cost of low-cost housing. They make an enormous difference to health outcomes and education outcomes for children. We have to continue to reduce costs wherever we can for families. The government, I think, has done well in improving access to early childhood education, and we'll see free primary care for children under 13, including after hours. Those are good things. We need more. We have to address debt. The poor need access to credit, but 10% per week is 500% per year, and that simply should not be permissible in New Zealand in 2014. And we must address social hazards, gambling and alcohol. We know that pokie machine owners and alcohol outlets specifically target low-income areas, and that is wrong. Alcohol is just too available and too cheap. You can buy a 15-pack of 250ml ready-mix 7% for $12. Think about it, that's about $5 a litre. And that harms our young most of all. So, all of these are contentious. They get people wound up. They're values-driven. And we have a political system that's contested. My view is that we need to change. The New Zealand public first. We need to throw our support behind these simple ideas. And when we do, we will see policy change. Thank you all for coming. Once again, thank you to the political leaders who've shown, I think, great courage coming here tonight. We're all looking forward to hearing what you say. Nau mai, haere mai, kia koutou katoa.